Hello, my name is Cormac Feeney and I'd like to welcome you to Troytown Equine Hospital's webinar on equine laminitis. Today we will go through some of the aspects of this disease which affects the horse's feet and some of the treatment options which are there to help your horse back to a road to recovery. First of all, we should talk about the anatomy of the horse's hoof. The horse's hoof developed as the single middle digit of the finger of your hand. The horse's hoof is the equivalent to the nail on the finger. It is attached to the pedal bone, which is the most distal bone of the horse's limb, by way of laminae. This is an interdigitating arrangement which we will see in the next slide. As we can see in the image in front of us, the horse's laminae are like little fronds of a fern. They extend out and attach onto each other. The PEL, which is the primary epidermal laminae, and the SEL, which is the secondary epidermal laminae, provide an attachment for the bone to the hoof. The cells which line each aspect of this arrangement are held together by tight junctions. The hoof is an extremely vascular structure as it needs a large blood supply in order to grow. It also has a very established nervous system, and conditions which affect the foot are often quite painful. The inability of the hoof capsule to expand in conjunction with the swelling which occurs in diseases of the hoof can cause severe pain. In laminitis, the separation and swelling associated with the disease of the lamina can cause not only a painful condition, but can also cause a structural deformity where the pedal bone and the hoof wall can separate. So as we've talked about, laminitis is a disease affecting the horse's hooves. In the video in the top right hand corner we can see a horse who is very reluctant to move. She has got a severe pain in both her front feet due to the disease. Her weight is sitting back on her hind legs as she's trying to remove and relieve some of the weight from her forelimbs. She's also very reluctant to walk forward as this is a painful condition. This disease results in pain, heat, and an increased blood supply to the foot. The increased blood supply can be palpated on the vascular structures at the back of the limb and are called digital pulsation. So, laminitis has several phases. The initial insult to the laminae, due to the disease that the horse is suffering, instructs or tells the cells that are holding on to each other on the hoof and pedal bone side of the attachment to let go. As in, the tight junctions, which are the little connections between the cells of the laminae, which are holding the hoof firmly in position to the pedal bone, are affected by the disease and begin to loosen their attachments. As these attachments loosen, the weight of the horse in conjunction with the stress of moving around causes the pedal bone and the hoof capsule to separate. The separation is followed by pain and inflammation as the horse's digital pulses increase, there is heat in the feet, and the horse becomes reluctant to move. In the video we can see the structural changes which occur. The image on the right hand side we're looking at now has a concave sole and is a normal hoof arrangement. The image on the left hand side we're visualizing now has a bulging sole as the weight of the horse's pedal bone is deforming the sole. Also there is a loss of the normal horn quality due to the laminitis.